So this is a case study which is basically done by Dr. Ivy it's based on an investigation that was conducted by Dr. Ivy, and she has been very supportive in developing this case study, which we will be discussing with you. So this is a simulation exercise. We want an interactive discussion among our participants. So here I would actually request any one of our participants to read the next slide for us so that we can do it in an interactive mode. So do we have any takers? Can anybody who is interested please raise your hand? Anyone?
Everyone is very shy.
Yeah, I see. You just have to read the slide. Any takers? No
Yes,
takers at all?
actually, someone raised their hand.
Yeah, yeah.
Yeah, it's a Hazel to everyone.
Perfect. Hazel, can you go ahead and read the slide?
Hazael, yeah.
Hazael, yeah.
Okay. Hazel, I have permitted you talking. Chisanga, you can read.
I think there's some issue with the audio.
Ediga, you can read now.
Yeah, there are 5 people who have raised their hands. And
I'm permitting them.
yeah. Anyone can read this, the first slide. This is basically a scenario of a health alert that has happened. So anyone?
On the 7th, can you hear me?
Yes, I can hear you. Please go ahead.
On the 7th of July 2021, there are reports of poultry deaths sent to the Director of Public Health for your region. She calls you urgently and shares this information. Around 500 poultry birds are reported dead on 2 backyard farms in the Tema, in the vicinity of the Greater Accra region, Ghana. She urges you to investigate and provide a report in 3 days. Hello?
Yes. Sorry. So going to the first question. Maybe you could actually attend the first question. Probably read and attend the first question. What do you think?
What are the possible causes of this condition? Well, 2, I think either Newcastle or avian influenza.
Okay, great. Yeah, perfect. So this is one of the diseases that we had in mind, that this probably could be an avian influenza. Any other suspicions? Anybody else wants to take a go?
No, I already said, or Newcastle.
Okay, yeah, Newcastle. Okay, that is another. Okay, let's go to the next question then. What kind of a public health event is this? Does anybody else want to answer? For some reason, I'm not. I'm going to the chat.
Outbreak. It is a kind of an outbreak.
Yes, perfect. And this was?
It was a kind of outbreak of flu. Maybe most probably it is avian flu or something like that, because it's coming from birds.
Perfect. Yes. Great. So I'm going to go to the next question.
Okay.
What additional information do you need, which would help you to investigate this public health event? What kind of data needs to be collected for this outbreak?
I think we need the type of the poultry and the severity of the condition if there is around dead bodies, it is accompanied with human influenza or something around the place. I think the origin, this is the most important type, the extent it is only in this area or appear in the another areas.
Well,
This is
sorry,
what I think.
Wow, perfect.
Can you hear me, ma?
Yes, yes, please.
I
Please
think
go
also
ahead.
we need to collect samples. We can
Okay.
take a
Yes,
trachea swab, nasal
Okay.
Yes.
swab. We take the sample and send to the laboratory for confirmation.
Okay, agreed. So there's one thing that you need to find data on
Hello?
what are the probable signs, symptoms.
Yes, then samples.
You want
to
to
be
take
taken.
samples for the of the animals. Apart from this, is there anything else other than for the animals that anybody would be interested in knowing?
Whether there are any human beings involved, since it's
Very
avian
good. Are there any human cases involved?
influenza.
True, true, true,
Yeah.
true. Yes, that's true. Just a request, like when one person is talking, it would be good if the other people allowed them to talk. But since it's an interactive session, and I know it's on a virtual mode, it's a bit difficult, but still, let's try what we can do. Okay, so I'm going to the next question. Question 4, do you think the country should notify the WHO about this event? Is there any relevance of this condition to One Health?
For sure, we should notify it, but the notification have a living. The first notification to the local health authority, from the local health authority to the Ministry of Health, and the Ministry of Health to the regional office of WHO. It depends on the severity of the condition, the extent of the problem, the upcoming mortality rate, morbidity rate. It is a kind of judgmental. You should, if the event is seriously take the nature and it is most probably become epidemic, so we need to notify WHO, and but I think we must go to the from the first stage of local health authority, then Ministry of Health, then the WHO.
Okay, so when do you think it should be considered that we should inform the WHO? When do we inform a disease to the WHO?
It is one of the threat that notifying by WHO, like H1N5 flu, influenza, SARS-CoV, including it is one of the threats. The threat is already known by WHO, and we have an enlistment country, but what we can notify the WHO. I think that every country have the enlistment of the disease that should be, when it appears, should be notified WHO. Okay.
Okay, perfect. Thank you. I think we'll go to so one of the things I would also want to share here is any disease which has a possible pandemic potential, as somebody has already mentioned here in the chat about the IHR 2005 and the diseases that are notified there. Oh, okay. So in those cases, in any disease where you have something of a pandemic potential, you have to inform the WHO, right? So I'm going to the next slide.
So Karishma, I'd also like to add, someone has written in the chat that we should also report to the OIE or FAO.
Oh,
the
yes,
veterinary
perfect.
service. Yeah, so this is also very important, especially when it's an animal outbreak. The veterinary services are involved, and then whatever samples or initial investigations, you send samples also to OIE or FAO. Thank you for that.
Thank you, Dr. Ivy. So here, I think Iman has his hand for quite some time. Iman, would you like to read the next slide?
Okay, I can read. You decided to visit the affected farm immediately. You constitute the team to visit the affected farm, and based on your initial assessment and the interviews conducted, you will call the director with ensuing the conversation. DCO, good morning, good afternoon, madam. Please, I am here on the farm. Director, good. Is this something to report? DCO, yes, please. Together, the farmers have lost close 1,500 birds. They're all together from 11 farm and farm hands, and 5 from the first farm and 6 from the second farm. And the farmer are telling us that some of the birds behaved strangely and died. Although the combs and whittles turned purple and they had diarrhea. We have to collect samples from the for laboratory analysis. Director, oh no. All right, is there someone from the lab with you? DCO, yes, please. Director, all right, keep me updated. Okay, what is the first question? Hello?
Yes,
Yeah.
the first question.
Who should constitute your team and why?
So shall I give this to somebody else to answer?
Yeah.
Does anybody else want to answer? Any hands?
Could I say something? Raymond here.
Yeah, please go ahead.
Good afternoon, ma.
Yes, please. Go
Good
ahead.
afternoon,
go ahead.
ma.
Good
My name is
afternoon. Please go ahead. I think, okay, we're getting information from the chat. We have team from from agricultural, animal, human, epidemiologist, veterinarian, laboratorian, and environmentalist. Okay, that seems to be a full team. Anybody else? I think somebody was trying to talk, but the audio got cut off.
Karishma, maybe I can help out because I can see it here. I see Chizanga, Chilesha. Maybe you would like to talk?
Yeah, please.
I can see the microphones and the hands up, so if it helps.
Yeah,
please
that would
go
help.
ahead, Chizanga.
That would really help.
No, I think it was accidental. I'm okay. Thank you.
Okay. No
Okay.
worries.
Anybody
Then,
else?
Suleiman, maybe?
Good afternoon.
Good afternoon,
Please go ahead.
Suleiman. Please go ahead.
This is Dr. Suleiman Mohamed Lawal from Nigeria. The team should comprise of people that have different skills that they are complementary. So you should have a veterinary doctor, a medical doctor, environmentalist, a lab person, a person that have the knowledge of the culture and of the environment, so that at least people can accept whatever they bring, so they can communicate whatever you do to them. They have to understand what's ongoing so that they cooperate with you fully. Thank you very much.
Perfect. Thank you. Thank you, Dr. Sulaiman. So obviously you will need a person who's involved, a veterinary officer who would help in looking regarding the animal cases. You will need a lab person. You will need an epidemiologist to help you in collecting, reviewing data, looking into exposures, a medical officer to look into cases. You will require an environmental officer to look into the environmental factors which might be responsible. Yes, and we seem to be having a lot of similar answers in the chat. Okay. So I'm going to go to the next question. What samples should be collected for testing, and what etiological agent should the lab test be for? Anyone wants to go for that?
I see Sarah Mueni. Please go ahead. I see you're muted. Sorry, we cannot hear you properly. Can you try again? No, sadly, Sarah, we cannot hear you properly. I'm going to go then for Ediga Achegbulu. You can unmute.
Yes, I was saying that we need a trachea swab, cloaca swab, and then nasal swab.
Agreed.
Okay.
Agreed.
And Dr. Suleiman, what if the animals are dead? If you have dead animals, what do you do?
Good afternoon. You can actually, from the carcass, you can actually take a sample from like autopsy sample by pathologists. So even though they are dead, you can actually assume them and take the sample from them as much as possible. And you can also take the fluid that's available from their blood or from the clockwise swab from the dead animals, especially within the 24 hours. Thank you very much.
Oh,
Yeah.
perfect.
Okay.
Thank you. Is there something we're missing here? Is there something else that we're missing here? We've spoken about samples from humans. We've spoken about samples from animals.
Environmental sample.
I'm sorry?
Environmental sample.
Yes, perfect. And what are the environmental samples? Where would you be taking it from? You have a lot of swab tissue, blood sample, animals, food, soil.
From the stool, from the soil, and from the environment where the beds are.
Perfect. Yes. Okay. So I'm going to the next question. What tools will be used to collect the data? What kind of surveillance will be followed? Anything else?
Would you like to talk?
Hello.
Hello.
Okay, we are getting answers on the chat. Do we have any takers?
Hello.
Yes.
Yeah, I think the head of the farmers association needs to be contacted also, so that the other farmers can start the biosecurity measures so that the disease does not spread to other farms.
Sorry, but we are looking into what tools will be used to collect the data.
Oh, I missed that. I think my network had some issues. I missed that.
Okay. Yeah. Maybe you could answer that also. What do you think would we be using to collect the data? Yes, we have answers in the chat. We'll be having a questionnaire. Somebody's talking about syndromic surveillance. Is there any other surveillance that we would like to do? Okay, there's active surveillance, tracing to know the extent of the outbreak. Good. Continuous monitoring of the mortality pattern of the birds. So we had a lot of discussion about surveillance right now. You have lab surveillance, you have participatory surveillance, very good.
Event-based.
You have event-based surveillance. Can anybody, okay, and interview schedules. Has anybody come across indicator-based surveillance? Do you think we would use indicator-based surveillance?
History-based, risk-based.
Okay, can anybody tell me what's the difference between event-based surveillance and an indicator-based surveillance? You can unmute yourself also and give me the answer. What do you think is the difference between event-based surveillance and indicator-based surveillance?
I see Jonas has his hand up. Please go ahead. If not, Suleiman, please.
Good afternoon. Event-based surveillance, actually a surveillance that is not organized, it's a kind of surveillance you can get from rumor, while indicator-based rumor, there are kind of surveillance that, for example, now you find people that maybe they are 20 years old, all of them are actually dying within the same age bracket, within the same address, and within the same geographical region. You could actually sign as a smoke, like a fire is coming. Thank you very much.
Okay. I think I missed out the last part of it, but basically what I just wanted to share was when you come looking at event-based surveillance, it of course, as mentioned in the chat, it refers to the event. You might get media alerts, you might get rumors, you might get there's a lot of there's a lot of answers coming on the chat. You get it's based on the events, while indicator-based surveillance are the reports that you get of diseases from healthcare providers. So yeah, so a lot of people have given us that answer. Going to the next question. Okay. Who do you think should be interviewed here? Key informants. Okay. Owners. Farmers.
see.
Anybody's raised their hand?
I see Ediga has the hand up. Please go ahead.
Yes.
Thank you. I just wanted to say the farmers, the farm workers, livestock trade, live birds traders, and then members of the community. Thank you.
Thank you, Ediga. I think you've covered most of it. Like anybody who is involved in taking care of the animals, who was exposed, whoever has been exposed to blood, bodily fluids, if they're involved in slaughtering the animals or consuming any uncooked poultry products, things like that. So they have to be also in your list of people who you're going to be interviewing. So going next. So what are the environmental risk factors we should be concerned about?
Emman, I see you have your hand up.
Okay, actually, I think the most important of the environmental risk factors that we should be concerned about, it is the pollution with this virus to the other sources. Maybe another animal can get infected, maybe another water sources, land sources, it infected with the organism. We don't know the types of the organism and how it is spread in the environment. So we should take care with the other land environmental resources like water, like land, like another animal present in the farm, human intact. All the other premises inside the farm should be, we are concerned with it, should have an eye environmental sanitation.
Okay, thank you, Iman. But specifically, if you're looking in the farm, where are the places that you would be looking into? Because we have to take samples anyway. Where would you be looking into?
I see Baby also has his hand up in case he wants to add something.
Yeah, a baby could answer.
Hello. Hello.
Hello, yeah, please go ahead.
Okay, I think most of the ideas are raised. We need to have, or we need to sample the premises of the house the birds came from, and any contact, maybe the clothes, the person or the attendant, and maybe the farm area should be sampled.
Okay.
Yeah.
I guess we have covered most of it. So like specifically what you would be looking to it would be, now in case they kept in cages or in any specific location, you'll be taking samples from those designated areas. Sometimes poultry feces is used as fertilizer, so you can identify whether it has been used like that in a field area, and you can take samples from that. And also
even we need to sample the waste disposal sites.
I agree, totally agree. That's a great answer. Along with that, even the water source, like they might be water troughs that are kept for these animals specifically. You could take samples from the water also. There has been links and possible exposures. There have been risk factors for transmission of the disease. So going on next. Anybody to read?
I think I can read.
Yeah, yes, Dr. Teme.
This is above. The lab reports show that out of the animal samples collected, 80% tested positive for highly pathogenic avian influenza, AH5N1 virus, that is HPA IV H5N1. All of the farmers' samples tested negative for HPA IV H5N1. There was one farmer who complained of cough but he tested positive for influenza H3N2. Environmental samples collected also yielded no virus.
Okay, so I'm going to the first question. So Dr. Adebe, sorry, Mr. Adebe, what is the interpretation that we are able to reach regarding the outbreak from the data? Would you like to go for that? Would you like to go answer for that? Anybody else would like to answer?
We can say this disease is not zoonotic.
Sorry?
This disease is not a zoonotic disease.
Okay.
Hello, Ma.
Yes, please go ahead.
I think what happened is that the farmer actually is able to get the infection through the animal, but there was transmutation from H5N1 to H3N2. The farmer got infected, and the virus now got mutated in its body for a new strain of the influenza virus. So it's still a zoonotic infection, Ma.
Not sure about that, sir, but based on what we have right now, what do you think is probably what we are seeing here?
I think based on what we have an outbreak of H5N1, and maybe simultaneously or something like simultaneously, accidentally, they have H3N2. What is the environmental sample collected also can be negative, no virus. This is with H5N1. So I think this is what we can regard that we have an outbreak H1N1. Maybe, I think I did think that H3N2 it is an accidentally come with this condition.
There wasn't animal to human transmission.
So yes, just like Dr. Ivy had mentioned right now. So what you have seen basically is an outbreak among, specifically among the poultry birds, but there has been no spillover incident to humans. Yeah. Yes. Totally agreed. So so our chat also, we have a lot of people who have mentioned the same, no transmission. This is not a double outbreak. There's no spread. This has limited itself to the birds. Yes. Unrelated or inconclusive. We can draw another research question on the level of IPC within the farms. Great question, great suggestion. But the question is still waiting to happen. So hold on to that thought, Hazel. So let's go to the next question. So what is your strategy to further follow up on this outbreak? Anybody to answer? Anyone else?
I see Abraham has his hand up. If you'd like to talk, Abraham. No, if not, Samuel. Someone, if you'd like to talk, please unmute. No. Okay, I see Abebe also might want to speak.
Why not Iman?
Oh, Imam. Sorry. I'm going through the list. That's why. Sorry.
The first question.
Go ahead.
No, that's
someone answering you. Okay.
Yeah.
I think the strategy now with this outbreak, it is we keep watch on I watch. We should be preparedness. We should be focused in this kind of farm. We should follow the complete sanitation. We should not allow this farm to contact other animal farm or other animal poultry. I think we take it as a focal point for our care to ensure that there is no another point of spot of infection from H5N1. So the strategy is people are surveillance, continuous surveillance is continuous in this farm.
Okay, man.
In addition, hello.
Yes.
In addition, we can do contact tracing line listing of all cases. Then we now
Contact
do
tracing of what? Of whom?
all the cases that we have.
So you want to look
All the
for more
cases,
cases around
yeah.
the farm.
Then we all their contacts, you have to line list them.
Okay.
And you have to enforce IPC. You have to strengthen surveillance so that any case that we have, we picked. And we have to do X promotion so that people know about risk communication, so that they know about the risk of having the influenza, so that we can control, prevent more cases from coming. And we have to, the cases we have to treat them very well. Because once there's no case, no transmission. So we have to, any case we have to ensure that we treat them properly so that we don't have any deaths. Thank you very much.
Thank you. Thank you.
Maybe I can add one.
Yes, anyway.
Okay. Regarding the contact tracing, I think we need to look whether there are newly introduced birds. If the disease ones are newly introduced, I think we need to go back and look the farm where the birds came.
Okay.
And secondly, I think we need to work on continuous surveillance on the people and on the animal, because
yeah, I agree. So we will have to
there are issues of time or incubation period. So continuous surveillance.
Yeah. And then what do we do with the birds there? What about the birds there in the farm? What do we do there? So we found so many were affected. What we
the
do?
first is to isolate the diseased ones, or those who are just showing clinical symptoms or signs. Then we follow the change and record. And finally, we may decide either to cull out or just to keep them in a confined environment for further follow-up. And the issue is not to get them productive. The issue is just to contain the disease.
Okay, so main thing, you have to contain the disease. There are in the chat I see isolate, cull the bird, see that the infected bird should be quarantined.
We need to first investigate the issue before culling the birds, because they are the source of evidence. We do not run for culling.
Okay, so you have to restrict the
we restrict the movement, we confine them in an environment, and then we do a daily or just hourly follow-up for changes.
Okay, fine. And
but there's a veterinary person in the team. You know, you are there for investigation. There's a veterinary person in the team. So the veterinary person should be able to recommend some things, and it would be better to sort of cull all the birds, depopulate the birds, and then get rid of them, because those who are not sick might still have gotten infected somehow. So it's better to cull all the birds. Now, this is where we have the problem with is government going to compensate the farmer? Because if there's going to be compensation, then it's easier for the farmer, for everybody involved, because of the fact that it could be zoonotic. So it would be better you kill all the birds, disinfect the farm, and then we leave, you know.
Yeah, agree.
And in the chat, people have said that we should cull all the animals.
Yeah. And another thing is that the virus tends to sustain in the bird, in the infected as well as the uninfected birds. They tend to remain in the uninfected birds, and there's a very good chance for transmission to happen. So, that is one of the reasons that they look into stamping out of the poultry, which is terminology that is used, and they ensure that the farm is disinfected for at least up to 6 months. And another important thing is that when the depopulation of birds are happening, or when there is culling happening, you have to see that these birds are properly disposed. The dead animals are properly disposed, and they do not act as a material which can cause further transmission of the virus. So, and we should also ensure that as Dr. Ivy has already mentioned, that farmers might not do it because of the economic effect of it. they might end up trying to sell those birds. So those are the things that we should try seeing that does not happen. So going to the next question.
Yes, Karishma, someone has a question in the chat. I mean, we can discuss it. He's asking
culling
Jonas.
of,
He said, is this feasible in developing nations and acceptable? Because usually what happens is immediately the farmers see that their animals are getting sick, or then they start killing them very fast, to rather sell it off, and so we try to discourage this as much as possible. I mean, in Ghana, we have ongoing outbreaks currently, and we have had to kill more than 100,000 or 200,000 birds actually, yes. But it is better we kill them than we rather lose humans, so that if we have huge numbers of animals with cases, and then instead of trying to kill them, you'd rather want to prepare them, and then you get infected, and then everybody around you can get infected. Then you, the humans, will start to die, then what was the, I mean, it's a huge risk for us. So it's better that we try and kill all of the animals, and then we can, go and quarrel with government about compensation. And we've been doing this. We've had a long battle with government about compensating farmers for this. And so hopefully we should try and empower at least the birds instead of trying to kill them and prepare them for the market. Over.
I totally agree with Dr. Ivy. She has, it is truly an issue that farmers are facing. So going next, what are the additional investigations that you need to perform? And there's one answer saying investigate the source of the outbreak, source of the infection, transmission routes, risk factors. No, there is no confirmed transmission between animals and humans here. Etiology, any other additional investigations we would like to look into? Data on previous outbreaks, if it has reoccurred, PCR for confirmation, vaccination.
We have also Chizulum who would like to speak. Please unmute.
Yeah. Please go ahead.
Chizulum, if you'd like to speak, please unmute.
I have unmuted him, but you can continue, Karishma.
Yeah, shall I go? Dr. Ivy, would you like to take this question?
Yes, of course. So someone has mentioned sequencing.
Viral sequencing, yeah.
Yes. Have Hansa Hadush, yeah. So he has mentioned sequencing. So sequencing is also something that we can do. I mean, the lab people can also sequence these samples, and with this, the OIE is usually very helpful for that. So immediately you send your samples, you get the sequences that say this and that and that. When we sequence, we can look at the genetic makeup of these viruses, and then when we do genetic analysis, we can tell whether we have like changes in the genetic makeup, so that we can see whether the virus can adapt to humans or not. So we can identify mammalian adaptive motifs in these sequences, and this is really important for us because it is zoonotic infection. So also when we sequence, we can do phylogenetic analysis, and these analyses sometimes give us like relationships among these viruses. So you can compare, say, viruses from Ghana to viruses from Nigeria, and then we start to debate whether these viruses came from, some other countries into Ghana, or Ghana is rather, or your country is rather giving out the viruses to other countries in your sub-region. I mean, we know we cannot control things like this because usually we trace them from migratory birds and all that, but these are other things that we can also do to, give us more insight as to how these outbreaks happen. So for us in Ghana, we have noticed that usually we have these outbreaks around these areas with like where usually migratory birds come, for other things. And so once they are interacting with the local poultry, then usually we have these kinds of outbreaks. Over.
Perfect. Thank you. Thank you, Ivy. So going on to the, so I'm going to go on to the next slide because we have basically discussed on what are the control and preventive measures here. Going to the slide here. Anybody would like to read?
Okay. So maybe before that, someone has a question. Is there vaccine for AIV? And would you recommend vaccination?
So regarding the vaccine for, does anybody want to give it a response?
To take that?
Does anybody want to give a response for that? Okay, Mercedes mentions that we have only a few minutes left.
I see Sarah has unmuted. Not sure if she would like to give a response. Sarah, please go ahead. No, we cannot hear. I see we also have a hand up from Chizulum. If you'd like to speak, please unmute. If not, Samuel, please go ahead.
Regarding the question on the vaccine, do you have anything to add? Or probably I'll go ahead with that. So regarding the question regarding the vaccine, so though there is a vaccine available, but it is not recommended for the outbreak, and that completely depends also on the national authority. As already mentioned here. Yeah, so I see somebody has also mentioned there in the chat box, but it is not a recommended measure for avian influenza. There are vaccines available. We would rather, and there is concern on whether there can be emergent strains which are resistant to the vaccine variety. So hence, rather than going for vaccination, we go for the other measures which are a bit more severe, but a bit effective in cutting down transmission. So going to the final summary slide, I think I'll read that. Dr. Ivy, would you like to read the last summary slide?
Sure. So our investigation shows that highly pathogenic avian influenza H5N1 continues to pose a significant global health threat with intermittent outbreaks in poultry. The West African sub-region has been experiencing outbreaks of high-path H5N1 among poultry since 2007, with a recurrence in 2015. Our investigation in this outbreak shows that poultry deaths were due to outbreaks of highly pathogenic avian influenza H5N1 virus. However, no spillover events were recorded among the farmers and farmhands. The outbreak was controlled by depopulating the beds, disinfecting and burying the beds. Dead beds were also disinfected and buried. Structures were disinfected and have been left without animals for up to 6 months. The biggest challenge was the delayed reporting from the farmers. We identified that farmers do not report such incidences because they do not receive monetary compensation from the government. Over.
So we have one question that I want to pose out for everybody here. So I'll just go ahead and read the question. What are the challenges that you have observed in the investigation and the additional studies you would like to partake for more effective actions? So I think one of the questions were answered previously is, would anybody like to share any more other possible studies or investigations they would like to do? Yeah. Anyone? Hazel had an answer before. Okay, one of the challenges was delayed reporting. Everybody's quiet. No challenges, no additional investigations. To conclude the source of the infection, Yes.
I see Eman has her hand
That's
up.
really
Please go ahead.
true.
Yes, thank
Actually,
you.
from the time of vaccination, I raised my hand, but actually something gone now. Actually, there is a vaccine for avian flu, guys. We can, other poultries and other birds can take the vaccine in the other farms. This is the first step to stop the outbreak. The others should be vaccinate their poultry, and the infected one should kill and not sell the infected poultry. So the health one take vaccine to avoid the infection, and the infected one killed and avoid from selling from the marketing. I think this is the most challenging something. It is how to conduct a vaccination inside the farmer, and how they convinced about the importance of vaccination. So this is the most strategy should be do. We should not encourage vaccination. Why?
Okay.
Why we should not encourage vaccination? This is
Okay. So there are two answers for that. I can answer. I can give you an answer for that. But just to add on, and because we are at a lack of time, I'm just going to read a few more answers from the chat. One is they want to look into probably studies looking at the acceptance of the farmer for the investigations, community and education, animal reporting, do perception surveys to understand community willingness to report diseases to authorities. So yeah, so basically here we are looking into participatory surveillance and how we can have the farmers themselves sort of report such diseases from when they see birds dying, or when they see any symptoms among the birds. So farmers are definitely, they're not willing to report, and we need to do sort of an action research and try to identify what are the ways in which we can engage them in such investigations and give them the information regarding that. And along with that, we will have to also engage stakeholders and the government and share the information as to what are the economic and identify what are the economic ways in which we could probably support the farmers in ensuring that they are reporting in time. And probably we could do more studies around that, around the behaviors, around the communication strategies. The question is, what are the challenges that you have observed in? Yes. So yes. So this answer was in relation to the second part of the question. Yeah, sorry, I read it wrong. Check the biosecurity measure in place so it does not reoccur. Sensitization of farm owners so they know the importance of reporting. We need to have editorials for communication. Yeah. So like basically we need to have more studies that look into these behavioral aspects and improve the surveillance mechanisms so that we can put an end to, we can bring down the occurrence of further such outbreaks. So with that, I would like to come to the end of the case study. Thank you very much. I think, yeah. Thank you again for such, I think I'll hand it over to Dr. Osman.
So thanks, Karishma. Thanks, Ivy, for facilitating and moderating that case study. It's not easy when we're doing it all in plenary, and obviously you've got over 200, 300 participants. So well done, guys, for moderating that. I think there's a lot of discussion, a lot of debate that's been had, and of course these are there are no single easy correct answers across these One Health type issues, because there's a legitimate right of farmers and producers around their animals and their livestock, and at the same time there's the issues around critical elements around human health. When it's just a human health issue, then it's very clear cut. You put in whatever intervention you need in order to save human life and and reduce morbidity and mortality. But when there are other economic dimensions as well involved, and they're in resource poor settings in particular, then the economic cost is very important, and that has a direct impact on the lives and the well-being of those communities. So it's not just as simple as, oh, we'll just kill all the cull all the birds or whatever. That has wide-scale ramifications and future implications as well. It has an impact on how the community will engage when you have a future outbreak, for example. So you have to take people along with you when you're making these decisions, and that's why the behavioral research element, the social research element, is so important. You have to understand your constituents. That's why these are best approach through whole of society approaches, through a proper One Health approach, where each sector's issues and concerns are respected and taken into consideration when mounting the response. And likewise, you've got to have the requisite research elements within each of the sectors. So thank you everyone for that, for taking part in this workshop, the lively debate. It's really important that you give us the feedback on the workshop. We have 3 more planned over the next sort of 8 to 12 months. Again, we'll be focusing on academic institutions in Africa, on rapid response teams that are part of the rapid response roster for the Africa CDC, but also with the other regional partners like the WHO, OIE, FAO, and UNEP, now that they're a big part of they're an equal partner within the quadripartite, as people have heard in earlier sessions of the workshop. So I think with that, thank you very much, everyone. It's been wonderful to have you all. I think we as organizers have learned from you, and hopefully you've learned a little bit from the panelists and the experts that have been there as well. It just remains for me to again thank all the participants, to thank the experts that have been part of this, to thank the panelists, to thank the other organizers, all the people that did the work in the background, the team from Chatham House, the team from the Global Health Network, and our colleagues and partners at Africa CDC, and in the sort of international regional organizations that have helped support this workshop. So Scott, can I just ask you to come in briefly and give us a couple of words on what the future workshops are going to be and when they might be, because it'd be good to have a lot of you back for some future workshops as well. And please remember, again, we want to try and improve these workshops, so give us feedback on the format, on the different sessions, and on how we might make it a better experience for all of you at future workshops. So Scott, I'll just hand over to you. You can close this out.
Thank you, Osman.
everyone.
Just thank you everyone for the great 2 days. I think the workshop went really well, and really happy with how the participants were super interactive, and also the super interesting presentations. Yeah, so just in the next, like Osman said, 8 to 12 months, we're planning to do 2 to 3 workshops. So the next ones that we're planning are related to social science. So we're also always considering the aspects of One Health in this, and research related to outbreak response. So the first one will be related to social sciences, and the next one related to risk assessments. So we'll let you know via email also, and post on the Global Health Network Africa CDC page about these events, so that you can also sign up. And looking forward for you to joining those events as well. I think that's it. I'm not sure if you want to close anything else. Yeah.